the Instagram. Yes, yes, yes. We are live. Welcome back to the Mosaic Lounge presents Melanin Mosaic Health, curated by Melanin Mosaic Performance Ensemble. I am the founder and organizer of this beautiful event today, Jared Polite, and we have the Reverend Dr. Christian Frazier. As I've known this person for at least 20 years.
It
And
seems like forever.
it's always been a great thing knowing them. But let me tell you all, for those who don't know, the Dr. Reverend Christian Frazier. Reverend Dr. Christian Frazier is a nationally certified mental health first aid instructor and a prominent advocate in the National Changing Minds Now initiative. He serves as the chair of the BIPOC subcommittee of the Zero Suicide Alliance Hillsborough and has served as a board member of NAMI Hillsborough. His dedication to mental health is evident in his role as a trained peer recovery specialist, trauma education speaker, and trainer. And he's also a hell of an actor who I've gone to know his work, and photographer and videographer and all the things that we've done together back in the day. So everybody, welcome to the podcast, Reverend Dr. Christian Frazier. How you doing today, my mother?
Man, I'm doing all right. It's been a heck of a week. I always have to shorten my bio because it's a lot. Because like I have a book that just came out, a
Author.
month or so ago.
Yes.
So I'm excited about that. It's actually a really life-changing book, and really there to help people with their mental health and their struggles. So,
Do you have a name of the book?
yeah, here it's called Unleashing Potential. As a matter of fact, of course, I gotta have one right here. But it's
Absolutely.
kind of like it's like having 20 life coaches at your hand. So they basically the publisher was looking for 20 life coaches from around the world, and found me and wanted me to do a section on mindfulness meditation. So that's what my chapter is about, and it talks about 15 ways to reinvent yourself because in this economy and society that we live in, we often find ourselves having to reinvent ourselves and do something a little bit different.
I absolutely agree with that. I went from being 99.9% a musician and recording artist to one day waking up and the spirit said, start Melanin Mosaic Performance Ensemble. And I said, yes. And I took literally a year off of music, recording, promoting myself to focus all my attention on this project and this family and this legacy that I call Melanin Mosaic Performance Ensemble. And I am thankful that I've had so many wonderful people who have been pushing me along the way, and people like you who I've talked to for so long about this project. And you were the first person who I actually reached out to about mental health first aid, and helped me get certified in youth mental health first aid.
That's right. You are a certified youth mental health first aider. That's right.
Exactly, and I'm looking forward. I can't say that I'm not looking forward to using it, but I'm looking forward to getting more people involved in the training and education of it, especially when we come from a world where we all deal with youth in some way, shape, or form. In color guard and drum corps land and performance arts, it's mostly about their bodies, but never about their minds. And like I always say, there's so many people going through so many things that we don't even recognize at times because we're just not trained to recognize the signs or how to properly assess the situation or give advice or direction to a young adult who might be in need, that we just go about our business as if it doesn't exist. And that is the opposite of what we should be doing, especially when our focus and activity wise is for the youth. If we're not taking care of their bodies and minds, what are we doing? We're just playing games with them, and that's not cute.
Yeah, and I feel like it's everybody's responsibility to look after our youth, whether you have children or not. It is all of our responsibility because it is our future.
Correct. I agree with you on that. So let's jump into the understanding mental health first aid and just understand what it is that we are talking about today. Let's get this slide up here today, and let's.
So we're going to do a mental health first aid overview. My sound went out, so I'm not sure if you can actually still hear me, but we're going to get right into the slide. First, we're going to talk about the problem statement. 50% of all mental health problems appear by the age of 14 and 75% by the age of 25. 12% of adolescents and 4.9% of adults had serious thoughts of suicide. 69% of youth ages 12 to 17 said they experienced a major depressive episode during the first year of the pandemic. And 45.2% of adults with a mental illness perceived the pandemic to have harmed their mental health. And then that's not all. The Black and Latinx children were about 14% less likely than white youth to receive treatment for their depression. Approximately 50 to 75% of youth in the juvenile justice system meet the criteria for a mental health disorder. And over 25% of Black youth exposed to violence have proven to be high risk for post-traumatic stress disorder. These are some of the issues and the problems that are out there. And again, in 2019, suicide was the second leading cause of death for African Americans ages 15 to 24. For Native Hawaiian Pacific Islanders 15 to 24, suicide was the leading cause of death. Self-reported suicide attempts rose nearly 80% among Black adolescents between 1991 and 2019. While the prevalence of attempts did not change significantly among those races and other ethnicities. And then if we look at some of the LGBTQIA plus youth statistics in mental health, the Trevor Project does a survey every year. And what they have found is nearly half of LGBT youth between the ages of 13 to 17 experienced bullying in the past year. And those who did report significantly higher rates of attempting suicide. And then also more than 1 in 10, 12% of LGBT young people attempted suicide in the last year. So those are some of the statistics. But let's talk a little bit about what is mental health first aid. I don't think that you can actually see that screen, or the video is not allowing me to play. So I'm actually going to go up to another screen so I can let you see this video. Give me one moment.
Yeah, there's definitely a huge gap in education for the information about mental health first aid and mental health as a statistic, because there have been so many Black and maybe Latino folks who always say, walk it off, you'll be fine, it's just whatever, and never acknowledging the fact that there might be a problem that needs to be addressed. Unfortunately, I've had people in my life, in my family, who have had episodes of distress when it comes to mental health, and it was never addressed in my family, so that way no one really recognized the signs until it was in your face, and it was like, okay, now you're cutting yourself. And we now have to address it because we didn't recognize the signs for 10 years, especially as an adolescent. And now we are dealing with it at a rapid rate. Like you said, these numbers are triggering to a lot of people who are like, wow, I didn't even know. And, it does affect everybody, and not just the people who have to deal with it. And we definitely need to make sure that we are always bringing it to the forefront.
No, we definitely do. And the stigma, I'm not going to even go through the video itself, but the first video that I have here is Michelle Obama. Michelle Obama actually took the mental health first aid training and mentioned that the National Council of Wellbeing, which I am a part of, we actually train 3 million people in the United States. We've hit that milestone. We're close to training 4 million people, and our goal is to train 1 in 15 people in the United States. Mental health first aid is basically just CPR for mental health. And what it does is it's a skill-based training course that teaches participants about mental health and substance abuse challenges, how to create a new path for resilience and well-being, reduce stigma and discrimination. Because like you said, we don't really talk about it in certain communities because there's a certain stigma attached with mental health. So when we show ourselves vulnerable, typically the community has either made fun or they look at you differently. So what we have to do is we have to normalize the conversations about mental health and also normalize the conversations about people being in distress. And I use this example is like if you were in a restaurant and somebody was, choking, you probably have 3 or 4 people who would actually come to the rescue that know CPR. But if somebody was experiencing a mental distress, people typically stay away because they don't know what to do. So mental health first aid is arming you with the information that you need to be able to identify, but also be able to help people with professional help and also give them some self-help strategies as well. And the reason why we want to do this, and if you look at this slide, is because we realize, especially with youth, is that if we can help a young person through a mental health crisis, it's more than likely, it's less than likely than that distress or emergency is going to turn into a long-term mental illness. And that's one of the things that we really want to do. We want to help prevent this mental, emergency, this mental distress, whatever's going on, because children are resilient and they can bounce back. But we've got to be able to provide them with the resources to bounce back. And that's what mental health first aid does.
Mm-hmm.
So then again, in the class, the participants, they learn the risk factors, the warning signs of mental health, also substance abuse challenges, the information on depression, anxiety, psychosis, substance abuse, and then our 5-step algae action plan that helps someone, while they're in the middle of a mental health or substance abuse crisis. And then also you have additional resources in the class that you get. There's the participant processing guide, which has a bunch of resources that are available to you. And I tell people, like, when you take the course, you're not going to learn how to diagnose somebody. You're not going to become a doctor, but you're really just going to be able to help somebody. And I always tell people, sometimes the person that you actually help might be yourself.
Yes, there are absolute signs of distress and mental health disorders that people don't even know they have until they start going through the program and processing the signs and the information of the different varied box of mental health disorders that you don't know that, oh, that does resemble a lot of me. Now I have a name that goes with it.
Exactly. You start realizing, like, hey, maybe I should. And then a lot of people that take the course, they start realizing that, especially those that have kids at home, start realizing that maybe I should start talking to my children a little bit better. Maybe I should have a different conversation with them. So mental health is like this. And there's a book about the African American Guide to Mental Health. And Dr. Rita Walker, she talks about how it's like the African frog in the pot. And it's like if you put a frog in a pot of hot water, they're going to jump out immediately. But if you put a frog in a pot of cold water and you adjust the temperature, what happens is that we adjust to every level of temperature. And that's what happens when we start adjusting to every level of stress. And then before you know it, it's boiling hot, but then it's too late to jump out. And then
Yeah.
that's when we have people going to the hospital, really mental health challenges. So many black and brown people are going to the emergency room to handle mental health as opposed to going to the doctor and taking preventative measures with mental health.
Wow.
I always say, like, you have to, and this is outside the course itself, but like, you don't want to go through life and the stresses of life and not have a therapist available or a counselor available, because it's like when you have that ultimate stress or event that happens and you're scrambling around, you don't want to have to go through the phone book or look through Google to find somebody to find that they only have an appointment 3 to 4 months later.
Yes.
You want to establish a relationship so they know you. You just say, I need some help now. And you just like, I need to talk to you tomorrow. And they can make, accommodations in their schedule because you have a relationship with them. And I tell people, like, therapy is so amazing. It's like preventative maintenance. And if you have relationships, like, sometimes it's validation. Like, I knew I was right in feeling the way that I do. Like, it's like giving you that validation and making you feel better and confident about yourself. It's not always about dealing with issues in the past. I tell people, like, you should just go to therapy when things are okay.
Yes. Preach. Yes.
When things are okay, go to therapy,
part of that
because
self-care. Mm-hmm.
yes, it is a part of self-care. It is a part of that maintenance that you do. So that way, when things do come along with that, like, life is like a bucket full of water. And then when that brick comes along, it gets your bucket, everything just overflows, and you got to be able to learn how to be able to deal with that. And we weren't taught coping skills. We weren't taught resilience in school, in K through 12, or even in college. And right now, mental health first aid is being deployed at colleges, at the K through 12 level. Like, in the state of Florida, if you work for the public school system, it is mandatory that you take this course,
Wow.
or
I
you
didn't know
won't,
that.
or you won't be able to work.
Wow. Is
Um,
that new?
it happened 2 years ago.
Great.
So every teacher, 80% of the people, not just the teachers, 80% of the employees for the public school systems in the state of Florida have to take this course. So now we're doing that there, and also at the University of North Carolina, they're implementing it so all of the students and the faculty take the course as well. And we're seeing entire police departments, take the course. So it's being deployed, and we have the studies to show that the efficacy of the course, it works.
Mm-hmm.
And I'm also hearing stories of people that, man, I was at a wedding, and somebody was going through a mental distress and almost passed, and I recognized it when it was able to help them. So we're seeing stories, and we know that it works. And again, we want to get 1 in 15 people in the United States certified in mental health first aid.
Wow. Great.
And we've already, I think we're close to 4 million. We've already hit that 3 million mark. I think that was late last year. So we're trending towards reaching 4 million in the United States, which is great.
That is great.
Now, the other part about the mental health first aid that I love to talk about is that the ending, it talks about self-care. And self-care is something so important that we don't really discuss today. Sometimes people think that self-care is selfish. Like, I feel bad about taking care of myself because I'm so used to taking care of everybody else. And I tell people, self-care is not something that you just do on the weekends. Self-care is
Yeah.
something that we have to practice every day. And self-care is getting enough sleep, going to bed on time, eating properly. If like I'm a diabetic, that means taking my medicine and managing, my diabetes. So there's different ways of self-care and how you practice and manage your self-care, but we have to take and put these tools in our toolbox, because when you're teaching and you're administering, say, mental health first aid, it can be stressful because you may be dealing with somebody who has an extremely stressful situation. I talk to teachers all the time, and they say that all of their children, every last one of them, has some form of trauma. And this is whether it's, I just taught 30 teachers in New York, and I talked to a lot of teachers here in Florida. It's across the nation. All of the kids are dealing with trauma, whether it's food insecurities, whether it is, financial, insecurities, whether there's just violence in the neighborhood. I even tell teachers you have to be trauma informed. Making loud noises in the classroom can be triggering to a student who might hear gunshots all throughout the night. So we make sure that we don't, that our teachers are trauma informed. So that's, some of the things that we teach in youth mental health first aid. And the other thing about youth mental health first aid, as far as the certification, it is a 3-year certification that you can put on your resume. So if you are working with youth, you want to add this to your resume because it is a valuable certification to have, and people are recognizing it. Like I mentioned, if you wanted to work for the school system here, you have to have it. But even if you were working for a school system where they don't require it, having the certification on your resume is powerful.
I totally agree with you on that. It does show that you've done work outside of your required responsibilities to not just teach these youth, but actually affect their lives in positive ways when they need somebody out there to talk to confide in, to confess what they're going through. That you are someone they can reach out to and say, "Hey, I don't have all the answers, but let's connect you with people who can help get you to the right place." And it doesn't take that much extra effort when you think about how much time you're actually with these young adults to do a little bit extra when you think or you see signs of there's something's not right. Let me talk to this person and reach out to them and see how we can effectively help them in their situation, so that they aren't bringing all that into the schooling and then making excuses why their homework isn't done because school's boring. But maybe it's not just because school is boring. Maybe because something else is going on, that they don't like going to school because they don't have enough food, or they're tired of whatever their situation is at home, that they feel
maybe
like
they're wearing the same clothes every day and the kids are making fun of them.
Exactly. So that you see them as they're horrible students, but yet they're going through way more stuff than you think they are going through. And if you don't know those signs or can't recognize it, then you're just going about your business like, oh, these children are idiots, they're stupid, they don't want to learn, they don't want to listen. It's not necessarily the reason that they're failing your class, but you should probably ask more in-depth questions or get to know them. And this training will help you understand those signs and warning triggers and get you to a place where you can actually effectively help someone who might be in need.
And the main thing, one of the things that we teach in mental health first aid is non-judgmental listening, and which is extremely important to be able to reach our youth, because they're not really likely to open up to adults, and they may not open up to you the first time that you reach out. So you have to make, the statements that, that my door is open. If you don't want to talk right now, you know, I'm here if you want to. And it is showing concern. We talk about using I statements. I'm concerned about you. It's really showing that you show interest. And I think it was Wayne Dwyer that made statements that people don't care how much you know until they know how much you care.
Oh yeah. Wow. Go back to the slide, sorry.
So also, I have a virtual class that is available on June the 14th, starting at 9 a.m. It is available via a grant from the National Changing Minds Initiative. So the class is normally $175 for the certification. I teach it through a college and also through my own corporation. And I know even the colleges charge over 100 and something dollars for this course. So to be able to get it at no charge, sign up. So look me up, DM me, or you look up youthmentalhealthtraining.com, and you'll be able to go right to the site and sign up for it.
Youthmentalhealthtraining.com.
Yes. And you can always find me if you just Google Christian Frazier. Trust me, you'll find me everywhere. so send me a comment or something like that. Sometimes my DMs get backed up, so send me a comment or something like that. But go to Youth Mental Health First Training. You can actually sign up for that class right online, and we'll get you registered.
That's amazing. There's nobody out there who shouldn't at least click on the link and find out what this is all about. Because, like I said, if it wasn't for me reaching out and just doing some little bit of work on the things that I wanted to learn about, and then finding people who taught that kind of course, I wouldn't know anything about youth mental health first aid, even as a topic. So it's really, really huge to find people out there who are willing to give the information willingly, and that's rare. So we thank you for that. Absolutely.
Appreciate it. I appreciate it. And look, if you're out there listening, get certified. I mean, it is worth the investment in yourself and in your community, because it's not even if you work with you might see some at the grocery store, at the park, or wherever it is that you might go that might be in distress. And again, you can make a difference in that young person's life.
Absolutely. Absolutely.
But I thank you for the opportunity, and I hope to see a lot of those faces from Melon Mosaic in the class, because it's going to be exciting. We're going to have some fun.
Yeah, again, youthmentalhealthtraining.com. Youthmentalhealthtraining.com. I took the youth mental health training. When did I take it?
It seems like last year, late last year.
Like December, November, December.
No, I think around November time frame.
And it was for the training that I went through, the certification training. I think I did like 3 hours online, and then we had a 6-hour class one day. And
it is like two hours pre-work that you do,
yep.
And then there is 2.5 hours of pre-work, and then there's 5.5 hours of actual classroom instruction online.
Yeah, and it wasn't institutional at all. It was people there who really wanted to know, people like yourself who were giving the information. And when you start doing the work, you realize, this is something I didn't know. And it definitely affected the ideas going forward for Melon Mosaic Performance Ensemble to not only put mental health as a priority, but to actually do the work in getting more people involved, to the point where I would love to eventually start a peer specialist training program through, people like yourself, to get more people involved in helping the youth in our marching art activity, who might not be comfortable talking to adults because they don't want to be a burden, or they don't want to be shunned or made to be a problem child. Or
those are the reasons why youth don't want to talk. I don't feel like I don't want to get my parents upset, or I don't want to put too much on them, or maybe my parents are already going through a lot and I don't want to put any more on them. There's so many reasons why. And that is the other reasons why we have this training, but we also have launched teen mental health first aid. And I know that I'm going to be launching that in this area too. So we're teaching teens between the ages of 15 to 18 how to help their peers out, because they may be more likely to talk to their peers about mental health issues than they will be to an adult. So we're also arming teens with mental health first aid training so that they can aid in the crisis.
That is spectacular, and I would love to do my part whenever you're ready to launch that. Just let me know, and we'll make sure that we get some people into that kind of program, as well as the youth mental health training programs and the mental health training programs. Because, like I said, there's always room to improve not just the body but the minds of our communities, especially performing communities where you're asking people to put away all their stuff.
It's
And
stressful anyway to perform all the time as somebody who's been in Hollywood for 20 years, 20 plus years. The pressure to perform all the time and to be on all the time can be extremely stressful. So definitely for our entertainment community, those in the creative arts. And last, I have to say this: we have a new resource in the United States. It's called 988,
okay,
and it is not widely known. So I always make sure that I mention it, because if you are having a mental health emergency, you can call or text 988 at any time, and there are counselors available on the other line that you can speak to, talk to, and then they have different, like if you press 1 for veterans, I believe if you press 2 for LGBTQIA plus support. So there are people that are available 24 hours text talk for you. So I just want to make sure that you know that that resource is available.
988. Please use it if you feel like you or someone else might be in distress, because we are in this all together.
Save it in
Doctor,
your phone. Save it
yes,
in your phone. Put it in your phone and save it, because you never know when you might need it.
I'm gonna make sure we start putting that on our mental health initiatives, and make sure that that number is saved into many people's phone as possible. Thank you again so much, Christian. You have been um, a life changing person in my life. Um, Not just mental health, but just being there whenever I need you. You like drop down. You're like, yeah, I got you. So again, this is an amazing workshop. Please give your time, give your energy, give your being to helping others if you can, and we will always be a better community for it.
All right. Enjoy the rest of your Saturday. Happy
Thank you.
Memorial Day weekend, everyone.
Good weekend, everybody. Take care. This is Jared Polite for Melanin Mosaic Health, part of the Melanin Mosaic Poems Ensemble Mental Health Series. We'll see you next time. Bye bye.